would be a complete disaster. I mean, think about all the hospital beds that we don't have. All these people, first of all, are going to end up probably on the streets outside of the hospital needing care. Think about how many people you just named with dementia, let alone MS and stroke and children with complex medical needs. And like the list is huge. So you have all of these people needing care, a system that already can't provide the care for these people, that are housing these people in transitional care units, waiting for alternative levels of care. It's a mess. Like it would never work. I don't see how that would work. All the healthcare workers would be like, I'm out. Bye. Like this is not possible, which we saw during COVID, right? Like we had a huge strain and pressure of our system. Many of my colleagues left because we couldn't handle it. This is like next level.
Stephanie, welcome to the show.
Thank you so much for having me.
So I got a Patreon question for you. As we talked about, we have a Patreon where members of the village who support the show get to ask a question. They specifically asked this question for you. You ready?
Mm-hmm.
Oh. I saw your video last week where you talked about no one visiting your mom before she died.
Mm-hmm.
How can I get our family to visit my mom more consistently? Do you have any tips?
Excellent question. Well, I wish I had magical answers for this one because we tried. And I think that with a lot of people that I work with, they go through very similar processes. So aside from asking and telling people what you think, your mom or whoever it is that's there would need, I don't think there's much more we can do, right? We don't want to be guilting people. We don't want to be asserting shame on people. And at the end of the day, it's their choice whether they show up or not for the reasons that they decide to. And we have to know that we did what we could to have them come, with the recognition that the truth is a lot of people won't come. And so I know that doesn't give all the answers, because it doesn't, and it's probably not going to yield outcomes that are different. But that's what I would say on that comment.
I think one hard part is that, if they don't come, then how does that strain the relationship? And I think maybe on the tail end, the implications are more significant for the family and the caregiver themselves more than it would be for the person living with dementia, right?
It can be, but frankly, I think like referring to this video that they're talking about, I was talking about how at least closer to the end of my mom's life, but honestly, for the entire trajectory of her dementia, barely anyone visited who wasn't our immediate family or my friends. My friends were amazing. Like they didn't even know my mom at the time, and they came and they were so supportive of me. But I do feel like deep down she knew somehow. And maybe that's just me extrapolating my own emotions and feelings about it and how it impacted us. But maybe on the surface, it doesn't seem to impact them. But I think for a person who's lived an entire life communicating with others, giving to others, having relationships with others, if that was me and I was, not seeing the people show up, even if I didn't exactly know who was there, I feel like it would bother me. I really do. And my mom had these glimpses of awareness that people wouldn't have expected when people did show up. So I don't know about that one. I'm on the fence.
So do you think then that quality would be better than quantity? So we're better to have the right people show up at the right time rather than this ragtag group of a bunch of people that we can wrangle up to come on in?
For the person with dementia, the
Yeah.
caregiver, or both?
Let's try the person with dementia.
Yeah, I definitely think that it's quality driven. I also think depending on what kind of dementia someone has and where they are, they can also be triggered and stimulated and overstimulated. And so, yes, it does depend on who's there. We don't want it to be like, oh, hey, here's neighbor Joe that you didn't really like, but neighbor Joe's coming to see you because I told him to. It's, oh my gosh, that is the person that means so much to me deep in my heart. The person I thought was my sister, right? So yes, those things definitely have more of an impact rather than bringing a whole random slew of people that they might not even identify with.
Have you heard from caregivers on the impact that they felt So obviously you have your own story with this, but have you heard from caregivers of how they felt this has impacted their dynamics with maybe the person living with dementia or their family themselves?
Yes, I mean, they primarily will state all the time that this has had impacts with them and their family, whether it's family that hasn't shown up, and they develop resentment towards them, they feel abandoned or betrayed by people, or whether it's people that they thought were close to their family, who they thought were close to the person that has dementia, and now suddenly they're not showing up. It causes breaks in many relationships in many different ways, and it leads to more grief. Honestly, you're grieving these relationships that you thought were there, and it leads to a lot more feeling of loneliness and isolation.
And so we had Susie Singer Carter on the show not too long ago. And so Susie, if you're not familiar, is the writer and director of the Academy Award qualified film My Mom and the Girl about her mom's dementia.
Okay.
And she talked about this story of uh, her and hearing from a lot of times the families and talking to them, and that this dynamic dementia diagnosis for caregivers and siblings and stuff will either make them stronger or fundamentally break this whole dynamic, right? The whole
Mhm.
relationship will break. So it's either one or the other. So you strengthen or you break it apart. So I think we need to figure out ways to, strengthen it rather than allowing it to crumble, which is frankly the easier route oftentimes, right?
Yeah. I have seen things crumble though and come back together. I will say there can be cycles of relationship dynamics.
Amazing. Amazing. Uh, Stephanie, well, let me introduce you to the audience right now. All right.
Mhm.
All right. So Stephanie is an award-winning clinical social worker and psychotherapist. Prior to transitioning to private practice full time, Stephanie worked in acute care and mental health research at several major hospitals in the Toronto area. Her work is primarily focused on caregivers and her aging loved ones. Stephanie has been featured on numerous television networks and radio stations, including CTV, CP24, and Rogers Television, and has presented at numerous universities and public events to raise awareness and mental health support. Stephanie has acted as a primary caregiver to several family members and brings her personal experiences to her work with clients. Stephanie has a strength based, non judgmental approach focused on empowerment and positive growth and change. She believes that our daily experiences in life are an interplay between ourselves and the systems that surround us, and how we have been impacted by our experiences from the childhood to the present moment. Stephanie sits on several committees and advocacy groups aimed at raising awareness and change for caregivers, including Caregivers Can, Canadian Centre for Caregiving Excellence, and the Caregiver-Centered Care Physician Advisory Network. Stephanie resides in Toronto, Ontario, with her husband and 3 little girls.
Mhm.
Busy life, Stephanie.
And a dog. I don't know why I didn't include that. I also have a dog.
What kind of dog?
A Bernedoodle.
Oh,
Yeah.
big and smart.
Yeah.
Trouble,
It's
trouble.
he's a lot of trouble.
Can you walk us through, Stephanie, of how you got down this road into this space?
Yeah. So, didn't think this would happen at all, but it started when I didn't even know what caregiving was. I was 19 and my mom started to present very differently than she typically had. She was always a little quirky, but things different definitely were different. And I soon found myself as her primary caregiver, as a young caregiver, and I was overly immersed in the healthcare system. I was immersed in getting her a diagnosis. I was immersed in bills and taking care of the house and everything that came with it. Just because it's what I did. Like I wanted to support my mom. But at the same time, I was really struggling in not being able to relate to any of my friends. Nobody understood where I was coming from. I didn't understand what was happening. And I thought that this was the rest of my life. Like I had no idea, I have a plan for myself at 19. What is this? Right? This is not what I had planned for. And so I tried to seek support myself and could not find anything that related to what I was going through. And years later, decided to become a social worker because I really have a likeness for supporting others with their mental health, and I was engaged in a lot of research in mental health, and I ended up working in an inpatient acute setting for almost 10 years with caregivers and the people they care for, and I was seeing them go through exactly the same things I had at a young age, but these people sometimes were 40, 50, 60, 70, 80, 90, and they were still going through that, and I thought it was just me because I was young and maybe I didn't know it was happening, but no, they were going through it too, and I realized that we needed to fill in this gap, so to speak, so I started my company, Compassion and Caregiving, which you noted is a mental health practice specifically for caregivers because that didn't exist. And still to this day, we are the only one that I know that exists. And so we started on that path to empower and support caregivers, not just in their daily lives, but also in navigating the healthcare system.
What specific gaps or lack of supports existed when you were 19 and a caregiver?
Well, my mom had, which now we know is a more rare form of dementia, called frontotemporal degeneration. In addition to, she had a very complex brain. So there's a lot going on. Her diagnosis was one that was very difficult. And in order to get her that diagnosis, I had to push GPs, I had to push neurologists, I had to find a specialized behavioral neurologist for her. I had to navigate, I thought she was going through a bipolar disorder. So I was navigating social workers and psychiatrists and found that to be particularly difficult. Wait lists and, not being able to get into something. My mom, because she had a behavioral component to her dementia, had actually done something that made a neurologist fire her as a patient. So we were starting from ground zero after doing all of this work. And I just felt like the system wasn't working with me. But again, I thought it was because I was a young girl. So I didn't know any differently. And then we encountered the hospital system and encountered a very big lack of communication amongst teams and not knowing how she was at baseline going into hospital and her being discharged at a completely different level of functioning and not communicating with the family and learning to advocate as a young girl or young woman, I should say, on behalf of my mother to be her voice everywhere in the system. And that taught me a lot.
Were you an only child, Stephanie?
I am an only child, yes.
So you had the dynamic of kind of had to fall on you then to support rather than this sibling interplay of who's going to handle in the back and forth then.
Right. Which I mean, that in and of itself, like we could argue that that could be worse sometimes. But no, I didn't have anybody. It was just me. I mean, my dad was around and like really stepped up later, but at the time that she became unwell, he was working and he was in denial, and so for a long time it was me, like all of the initial system navigation, and even as we went along, he relied on me to do all of the system navigation for her up until the last day of her life.
And what's interesting, especially when it comes to FTD, is I've talked to multiple people on the show. Even recently was Katie Brandt, whose
Mhm.
husband had FTD at the age of 29, and she was saying that the physicians were going and saying it's depression, it's all these other things, and she's like, that doesn't seem right. It didn't feel right. And there was actually a social worker, she said, who off the record was like, I would try and ask them about these things, and then being FTD
Right.
that Mike had, and so you're right. I think that it's a concerning thing though that the specialists probably are aware of it, but they're not necessarily connecting these different behavioral manifestations
Yeah.
to FTD. Where
No, and I see that all the time with my clients. Like I had one the other day where their family member was in the hospital and they were saying that the family member had Alzheimer's, and I was like, have they ruled out other dementias? This is sounding weird to me. And just again, providing education, which is very much part of my job, but these are the avenues that you could go and advocate for to make sure that we're ruling everything out because this feels weird to me.
how did the system navigate you being 19? Because I feel
Mhm.
like the system by function is so bureaucratically heavy and complicated that one, you may not necessarily have known the processes and avenues of how to navigate health system in Ontario. But then being young female, you might have been probably dismissed, right? What was that like?
I think honestly, we were a little lucky. I'm going to say a little lucky because there were parts of it that took a really long time and there were parts of it that were easier than what I've heard from other people. I think that I was lucky in the fact that I was so young, and I think that the final specialist we had ended up with, I don't think had ever really encountered a 19-year-old girl calling the office 3 times a day, which I was doing at a certain point, to say, "My mom needs an appointment immediately, and we're not waiting a year," which is what they had initially given us.
Okay.
Um, I think that they felt bad for me, honestly, and I think that if I had been their typical demographic, maybe they would have said, "No, please," but because I was calling and saying, like, "I need help, there's something wrong with my mom," they even said to me, we don't have this." They moved her appointment up. So, in some ways, it was in my favor, frankly. In other ways, it wasn't because you're right. People, I don't think, took me as seriously, especially in the hospital. I found that when she was admitted in the hospital and I was talking to, I'm not like it wasn't one specific healthcare worker, but many different ones. I don't think they took me seriously because it's like, who is this little girl or who is this young
Mm.
girl? I also experienced that because I cared for my grandmother as well in between this. And I definitely had that with her where they would be like, "Why is no one here?" Right? Like, "Why aren't you coming? What's going on?" And I'm like, "I'm the only one that could possibly show up." And they're like, "Why are you not here more?" "Well, because I'm in school." Like this is not, but again, they didn't understand because they're so used to someone coming in who's older with these people. Um, so I don't, frankly, like, though, I don't really care what people think about me when I'm advocating for people that I love. I was approached as a difficult caregiver a lot of times, and that just fueled me more to be like, okay, well, I mean, then I'm doing something right. I'm going to keep pushing your buttons until you do what we need you to do. So it was a bit of back and forth, but the system never, I don't think it ever played me because I ended up doing exactly what I needed to do at the end of the day.
What advice would you then say to a caregiver that's in your position, early 20s, late teens, that is going through this space? Because we're hearing about it a lot right now with
Yeah.
especially with FTD. So what
Yeah.
would you say?
I'd say A, don't try to do everything yourself like I did if you don't have to. I mean, there's not always an option, but I think that I thought I was a superhero and I could do everything alone. And I think that probably should have called on other people more than I did, but I'm like, nope, leave it to me, which is very much my personality. Um, so A, I wouldn't be a hero, but I would also say that we can't do it all. And so you have to be mindful of the fact that you have a lot of different things going on. You are also coming of age. You're trying to figure out what you're doing in life and where you're at. And we can't give up all of ourselves to provide care because you also have a future that you need to depend on. Like, this is the time where we're building the foundations of our future. So be mindful of everything happening, but do what you can. Lean on others when you're able to. We cannot do everything by ourselves. But also, if you're the only one that can speak up and be there, speak your voice. You may feel like people don't take you seriously and don't trust you, but when you have an opportunity to talk, just say what you know because you know this person likely better than anybody in front of you. And that's what's important.
What age was your mom when she got diagnosed with FTD?
62. When she was diagnosed around 62, 63. She definitely had symptoms around then though.
Was there any indication earlier on that made you say, "Hey, something's a little off here. We're seeing something"?
Looking back, yes. I mean, I talk to my dad about this all the time. We're like, oh my gosh, we can look back as far as 30 years and see things, for sure. But again, she had a very complicated brain. Like, my mom had meningitis when she was a little kid. So she had calcium in her brain from the meningitis. She had other stuff in her brain. So it wasn't just isolated to this. And I think that all of these brain functions were altered by what was happening in her brain as a result of the
Um,
meningitis. So it's hard to pinpoint what was from what, but we definitely look back and we're like, "Oh, that was weird, and that was really weird, and that was definitely weird." But we just thought she was quirky.
so what specifically led you into social work as a field?
So I initially wanted to be a veterinarian. and I went to university to become a veterinarian. I went into life sciences, but I always had a passion for supporting people with their mental health. Even when I was in elementary school, my friends would be calling me to help them, and I would sit on the phone with them for hours. Like that, I loved it. That was what I loved so much. But I always was worried that it would be extremely draining for me to become a social worker or a I just thought, I feel so much for these people. How can I do this work? It's just going to kill me at the end of the day. And I also loved animals. And so I said, I'll just be a vet, because I can be with them and I can love them and then I can just help the people that I love on the side. But then I found out for the MCAT I had to do physics and organic chemistry was not fun in undergrad at all. And I said, nah, we're not going the physics path here. They removed it since then, so who knows where I would be. But at the
It's interesting.
time,
Physics is a thing that they have to
yeah,
take.
it isn't anymore.
OChem, but not physics. That
They
is
got rid of it. It was physics. They got rid of the physics part. But when I was studying for the MCAT, it was physics. So
because you
while I
pushed, right? You
was
said no more of this.
Yeah, I'm like, I am not doing physics. Like vectors, goodbye. So I had to think about what else to do. And I was so scared of doing therapy that I tried to think my way around it. So I was like, how can I work with someone's mental health but not do direct therapy? Because that's going to be too burdensome for me. So I thought I was going to go into occupational therapy and go into the mental health side of occupational therapy so I could help people with their daily functioning if they had mental health concerns. Anyway, long story short, I ended up working in a few downtown hospitals in research in mental health. And I loved it so much that I'm like, I don't know what I was scared of. I'm going to become a social worker. So I applied to my master of social work and I got in, and it's the best decision. Like I love it. It is not burdensome at all. I mean, they're definitely learning along the way, but I love it so much.
What was the order of process here? Were you started the company and then finished your master's, or did you finish master's then start
No,
the
I
company?
finished my master's, then worked in the hospital for a while. And then
Okay.
while in the hospital, it was actually during COVID when it was the worst for caregivers. During COVID, they couldn't even come into the hospital where I said, no, I'm going to start the company. So I started my company 5 years ago and I started working in the hospital system in 2015. So
Wow.
I was working there for like 5, 6 years before I started the company.
And what led you to want to start the company versus continuing to support caregivers through hospital and acute care settings?
There were a lot of things I couldn't do for people in the hospital. In acute care and social work, at least in the hospitals I worked in, it's very discharge focused, which comes from the top down. So, unfortunately, there were a lot of opportunities for me to provide emotional support and be there for these people, but I didn't have time to do it because we had to figure out how people were going to get discharged quickly, what plans were going to be put in place. And if there were complexities of the plan, that was my priority. It was always
Mm.
discharge comes first. So the emotional support ended up coming in at the end. And sometimes I had to be involved in discharge plans that I didn't necessarily agree with just because it was for the best interest of the hospital. And I didn't have a choice because you're working, like we have to have people come from the ER up to these beds. We have to empty the beds. There's no option there. But there were a lot of things that where I would feel like an enforcer a lot of times, and I couldn't give people the time and space that I knew they needed. And then we were just kind of like, goodbye, see you later. And there was no follow up. Once they're out, they're out. They can't call me back like I'm part of the inpatient team. Um, and so there were a lot of things I wanted to do, but there was also a lot of policy work that I wanted to get involved in. There was a lot of change that I wanted to do in systems in government that I could not possibly do in the hospital system. I was bound by, rules and regulations of hospital. Like I'm upholding the hospital, of course, as an employee, and I needed to go out there and do what I needed to do.
Are you How are you seeing the system now for support? Is it getting any better in your perspective?
I think that there's more awareness of what caregivers are and what they're going through. And honestly, I credit a lot of that to the CCCE, the Canadian Center for Caregiving Excellence, because of their reports and their research and all of the advocacy they're doing. Uh, but a lot of more people know that this is an issue. And I think when I started my company, nobody even understood what a caregiver was. And so we've come a long way. Unfortunately, the funds just aren't there for support. So I am seeing like peer support groups, I'm seeing, webinars and workshops, which are all great, but we don't have that, what I would call that bespoke custom therapy that caregivers really need because everyone has a unique experience. And I understand why. It's expensive. Like, we're not a cheap service, right? I mean, people can take advantage of us through benefits, which is great. But I am not seeing that. And I am seeing a lot of practices pop up and say, oh, we support caregivers because it's the buzzword of the day. And they think that they're, going to bring people in. And I don't want to talk about people's intentions. I don't know what, I'm sure their intentions are pure, but they still don't know caregiving. And the unfortunate reality is that unless you've been through it, you can't possibly fully understand what caregivers go through. So we have a very unique model that I think is very hard to replicate unless you've had all the experience that I've had and which the clinicians that we hire have had. So it's like it's two parts, right? One is there's no funding. So government couldn't possibly, like I'm talking about government funding and public service systems, they don't have enough funding to provide that one-on-one therapy, or if they do, it's very limited or student run, which is in and of itself something. It's way more than they used to have. And the other piece is that I think there's an avenue of you can't understand the caregiver unless you really understand the caregiver, right? So it's, yeah, two-pronged, I would say.
I mean, we see funding that is starting to support various things, but I don't think
Hmm.
it's truly reflective of what caregivers need. I mean, support mental health is very important, very good. But when we think about, at least my perception, caregivers, part of the problem is I need to look after this person. I'm so focused on them that I'm not focusing on myself. So the
Hmm.
burden of what they're going through is heavy. But then you also have the problem of oftentimes they have to leave work, not focus on work, these sort of things. So you have the economic impact that's also weighing on that's difficult. And
Yep.
I think it's New Brunswick or Nova Scotia or somewhere down east is the only province that funds caregivers.
Hmm.
And like that would go so far as supporting probably some of this mental health because I'm not having to figure out how am I going to pay my mortgage while looking after my mom.
Yeah, I mean, the truth is, I think the mental health part comes later. So I advocate for a lot of things that aren't said. I think that really the priority and what the government's trying to focus on right now, from what I see, is allowing caregivers to continue on because at the rate they're going to burn out because we don't have the home supports that we need to keep people at home, right? That's the mandate now is let's age at home. Let's not inundate our hospital systems. I understand that. That has to be the top priority of where the funding is coming from because we can't have people cycling through hospitals. They're still cycling through hospitals. So I think that's the problem that needs to be targeted first. But unfortunately, throughout all of that, there is a lot of trauma that caregivers go through and a lot of emotions and a lot of relationship breaks with healthcare teams and people in their personal lives and guilt and shame and all sorts of stuff that is pushed back. And it would be amazing if that would be offered in tandem. But I think we have to figure out each layer as it comes. And there's also the financial pieces, which you were talking about, right? If you can't do the day to day, you can't buy food and you can't afford your mortgage, how are you paying for therapy? Like, again, that doesn't make sense. So I'm very aware that the mental health piece is a later thing, that maybe once we tackle these other fundamental pieces that we can talk about the mental health. The sad part of it is that the financial and also the circling through is causing a huge burden on mental health. So how do we do it together? And some of our clients do like they come once every few months because that's all they can do, or they'll lean on some sort of benefit plan, like something. But it's tough, right? We have to unpeel, like we have to peel the onion and take these layers as they come.
So how do you, or I guess, what are some common discussions that you have with caregivers? They say, these are the problems that I'm experiencing and I need support. What are some of the big high level ones that you see fairly often?
Well, what I find primarily is that when people come to us, they think it has to do with caregiving, but we find out pretty soon that the caregiving is this like overarching piece that has kind of broken what they were going through and actually sustaining long term to begin with. So you'd think that they were coming for the caregiving part. I would say over just over 60% come to us for healthcare systems navigation. So that's a big part of it. And then the other part actually is what the caregiving has raised in them. So when you talked in my bio about things coming up from childhood, there are a lot of ways that we approach stressors in our life and situations in our life, and ways that we've learned to adapt to situations that do come from how we were raised. And so we start to recognize patterns of, are you actually processing emotions? How are you dealing with emotions? You might see a lot of anger, or you might see a lot of anxiety, or you might see all of these things. And you're realizing that these things aren't actually, it's not from the caregiving per se. It's deeply rooted and it's coming to the surface from caregiving. And then, of course, there are the stressors from caregiver burnout that we see a lot. But I do find that it's very intermingled. There's a lot of deep stuff that is brought to the surface from caregiving, and it has nothing to do with the caregiving itself, which you wouldn't think.
I think one problem I see, and I'm curious your thoughts, Stephanie, is that across Canada, each province has a health body, and in some it's more. Alberta, just broke up, and there's multiple.
Hmm.
BC has 6, I think, maybe 7,
Hmm.
and so you have all these fragmented ideas, and it's like, this is how we're going to solve in this place. This is how we're solve this place, and in BC, I mean, you get the minister of health oversees these 7 different things, and you can't ensure all these 7 are going the same direction. So, and then across all provinces and territories, it's scattered mess. So, where you have some policies in place to support caregivers that are working great, it's not necessarily being reapplied to these other areas. And conversely, you have some problem or some policies that are being implemented to solve problems that's actually being copied, that's causing more problems, like this long-term care bill that just
Hmm.
went by in Ontario, whatever, 6, 8 months ago.
Yeah. Yeah. I think that, as we look at the entire country, and this is a conversation I have a lot of policies definitely go against each other, and a lot of bills go against each other, not just within provinces, but across provinces. And so we might have something happening here that doesn't at all function well with something in another province either. So if you're in Ontario and you're providing care to someone in BC, and I know someone in this situation, we're like two entirely different systems. They're not
Mhm.
matching at all. And so I see a lot of caregivers struggling with the distance caregiving across provinces, right? We're not this like huge united country that has this caregiving plan and this healthcare plan. We're all fragmented. And I think that's a big part of the issue. But yet, within that fragmentation and within each province, we're also fragmented. And it's very
Mhm.
complicated and confusing for, I think, every party involved, including government. Like, government also gets confused. I talk to ministers, and I talk to members of parliament, and I say, like, well, what about this or what about this? And they only know this one piece, but they don't know this other policy because they've never had to deal with it, right?
I think it's so complicated that oftentimes it's I'm going to pass it down. I'm going to let someone else deal with it.
Yep.
Saskia, Dr. Saskia
Yep.
Sivananthan.
Yep.
Yeah.
I
So
know her
when
well.
she was on the show a while
Hmm.
back, and her and I basically had this conversation of who is really responsible for navigating it. In the context of our discussion,
Hmm.
we really were talking about, like, is it Danielle Smith in Alberta? Is it Mark Carney? Considering we're here. And there was this kind of Spider-Man meme, everyone pointing fingers at each other. And it's like, no, it's you, it's you, it's you. And ultimately these caregivers are left behind, just saying, I just want somebody to help give me the support. Someone saying, this is where I need to go. This is how we're going to help solve, just getting my loved one into a supportive facility.
Hmm.
Everyone says that this, or this. And it's caregivers are oftentimes, I find, last thought through.
Oh, yeah. Caregivers aren't thought through. I've been around tables where we're having large healthcare system discussions, like very important large healthcare system discussions and decisions, and no one talks about the caregiver. Like, no one will say anything about it. It's like, hi, um, by the way, there are millions of people in Canada who are actually holding our system together and are actually underneath all of this. And your system would collapse without these people, and they're like, no, we don't need to think about the caregiver because they're a given, which I actually posted about recently on LinkedIn. Someone said that to me at a conference. Like, we don't need to think about the caregiver because they're a given. So that seems to be I mean, I'd like to think that a lot of people don't think that way, but there is this perception that, well, they're always going to be there. And some people that work within caregiving will say, yes, they will always be there because historically this is how it goes. I would argue that they won't be because they're breaking. And how can caregivers continue to be what our system has expected them to be if they're breaking? How do you how do you do that?
I saw somewhere, I think it was an Alzheimer's Society report maybe recently, and they were saying that for the 600 and some thousand people
Hmm.
in Canada living with dementia, there's like 400, 500,000 full-time caregivers.
Hmm.
So it's almost a 0.8 to 1 ratio
Mm-hmm.
of people living with dementia to people who have left their employment
Hmm.
to be a full-time caregiver,
Mm-hmm.
or they're being a full-time caregiver in addition to their full-time employment. Both bring their own,
Right.
problems. But both instances, the people are challenged, they're struggling, they're trying to figure a way through, and we're not reasonably thinking about that large population,
Mm-hmm.
which is in 5, 10, 20 years, we're going to have more problems because they might have some mental health problems associated with what they've gone through, the system not being there and to help them. We're just, I don't think we're equipped long term to for what these people need.
Yeah, and it's not just mental health. I mean, it's physical problem. Like we know that the mental health of it and the stress of it actually implicates them physically. And we also know that 1/5 of caregivers die before the person that they're caring for. Like that stat is too large. So,
Oh, I didn't know
you
that was
know,
a number.
yes, and caregivers end up utilizing the hospital so much, not just for respite, which is sometimes why they do, but because they're dealing with their own physical ailments. I mean, I have seen so many caregivers who have been under tremendous, constant stress develop all sorts of physical issues. And, do you know Gabor Mate?
No.
So Gabor Mate, he's a mental health clinician, pretty renowned. He also writes a number of books and indicates research that our mental health very much implicates our physical health. There is research out there to show that autoimmune disorders, the rate of getting them is much higher when you're dealing with chronic trauma and chronic stress. So it's not one or the other. We have to see us as a whole person, and the reason our system doesn't really identify caregivers, in my opinion at least, is because they haven't had to, because the caregiver has always been there for the most part, right? They rely on the caregivers to provide almost like billions of dollars, right, to our system that they would otherwise have to fund themselves because they don't have to think about it.
What do you think would happen, Stephanie, if we have a, Avengers Infinity War sort of snap where all the caregivers go away and
Mhm.
the government is left to scramble because they've all just kind of poofed into dust? What do you think would happen?
Oh my god, it would be a complete disaster. I mean, think about all the hospital beds that we don't have. All these people, first of all, are gonna end up probably on the streets outside of the hospital needing care. Think about how many
Hmm.
people you just named with dementia, let alone MS and stroke and children with complex medical needs. And like the list is huge. So you have all of these people needing care, a system that already can't provide the care for these people that are housing these people in transitional care units waiting for alternative levels of care. Um, it's a mess. Like we just it would never work. I don't see how that would work. All the healthcare workers would be like, "I'm out. Bye." Like this is not possible, which we saw during COVID, right? Like we had a huge strain and pressure of our system. Many of my colleagues left because we couldn't handle it. This is like next level. Next level.
Do you think though we're kind of getting to this point though where that is almost starting to be a direction? Like you said, COVID was a great illustration of what can happen. And a lot of caregivers, I'm hearing the kids are like, I can't do this. And I'm walking away. And then it's uh, a sister or it's a cousin or it's
Mhm.
a neighbor is now taking on that burden because the kid's like, no, not happening. So I'm wondering, do you think we're starting to see that as a manifestation? Obviously not to the same extent, but we're going that way.
Yeah, I think this is complicated because I think there are cultural impacts here too and
Mm,
generational impacts too. So I think if we looked back 80 years or 100 years, the expectation, which is still true in many cultures around the world, is that you as a child are going to take care of your parents. That is, across the board what was happening. And so that was just this assumed responsibility of the generation and the culture. What I'm seeing happening over time, not just because caregivers are being burnt out and can't function in the system, alongside that, what I'm seeing is that in the younger generation, we are upholding a lot more of this autonomy in North America. This, I'm going to do what I need to do, establishing boundaries, which is not necessarily a bad thing, but our younger generations are pushing back against what these implicit norms were back in the day. So I'm seeing them get burnt out, but I'm also seeing the younger generation saying, well, I don't need to do this. This isn't what I'm doing. Like, I have to take care of myself. I have to
Mm.
uphold myself, which was never part of the conversation. Now, in the multicultural community that I live in, you see a mixture of that because you're still seeing people that are of the younger generation coming from cultures in other countries and immigrating saying, well, no, I have to provide care. That's just part of what I'm doing. Don't even call themselves caregivers. That's just part of what they do. But I do see in our culture specifically this thing coming along the pipeline where if you have a child who's like 20 years old or young, even 25 years old or younger, their entire generation has a very different way of thinking. And I think that's a big part of it too.
And I've heard from a lot of the the ethnic minorities here in Canada that have said, I've heard it from lots that say, I don't care what happens. I'm going to move back home and figure it out because I don't want to be put in an institution. I don't want to be put in a home.
Hmm.
I don't want to be forgotten about. I'd rather lose all my benefits and go back to wherever it is because I don't want to deal with that. I don't want to
Hmm.
have the repercussion of that. I'm afraid of ending up in one of these facilities. I've heard it from many folks,
Interesting.
which
I
is
haven't heard that one yet, but that's
no,
very
it's
interesting. No.
I heard it from someone specifically this weekend,
Hmm.
and yeah, I got an email this weekend,
Very
which
interesting.
it's sad because you're willing to forego all of your benefits.
Hmm.
In our case, Alberta Health,
Hmm.
because of trepidation of the system and uncertainty that your loved one will carry you along and support you.
Hmm. Interesting. Very interesting.
One thing you posted, Stephanie, recently I thought was interesting was about the caregiver Barbie. The
Hmm.
idea that, you know, how do we normalize this? And it was with Carlos and Mattel. I don't know if they responded to you or not, but
Not
it
yet.
would be it would be interesting, right?
Yeah.
To normalize it and demonstrate to the younger generations like yourself who would take phone calls from your friends like this is kind of what happens. This is a real thing, and this is how we support.
Yeah, I mean, I watch my kid. I have little girls, so I watch my kids, and you don't have to be girls to play with Barbies, but they play with Barbies, and I observe the way they play with them. Right? It's very much here's mommy Barbie taking care of little teenage Barbie who's growing up, and then teenage Barbie gets a boyfriend, and like that's how they play. And I think to myself, like, this is interesting and all, but it's very normative and it's very fantasy land. And this is just not the reality of life. And we don't see that's no different than when I was young. But if I had some sort of an example growing up that, okay, yes, there's this, I'm playing with caregiver Barbie and there's someone in a wheelchair. And like that's part of raising someone too. And this is part of the experience in intergenerational households and cultural differences. Like we don't see that enough. And I think I would feel so much more validated and normalized just knowing like, okay, here it is, right? Like I know this is a thing, but that's fine because this is what I did anyway. Just like we aspire to be parents. I'm not saying people aspire to be full-time caregivers of someone with a declining condition, but let's just at least expose our children or our communities to something that looks a lot more than this normative picture that just isn't realistic.
How would you reckon then that parents can normalize this concept of caregiving for children? I mean, being other than just being there and being around it and watching their parents do it. What other tips and strategies can you suggest?
Yeah. So, I mean, there's watching your parents, but what I really do see is a lot of parents being scared to expose their children to caregiving, scared to bring their children into the room with someone with a dementia, for example. Like if a grandparent has dementia, they're afraid of what that's going to do to the child. And so, obviously, you have to know your child best and how they're going to react, and every child is different. But I would not shy away from including children in those experiences if even your family is going through it, like making them part of it, making it fun, making it exciting. My children were at my parents' house all the time with my mom when, she was nonverbal and in a wheelchair and using a Hoyer lift, and we made it fun. They were like, "Oh wow," they're like, She's like Paw Patrol flying through the air with her Hoyer lift." Like that's how they saw my mom. So I think as a society, we put dementia in a very negative light and we try to hide, which is funny because you're talking about this earlier from your Patreon question. Why do people not come to see people with dementia? Because we see it as this really scary, horrible thing that we can't possibly approach for whatever reason. Why do we think that? Because we're scared from a young age. We isolate our children, we isolate our teenagers, like we hide them. Whereas in Nordic countries, that's not we're integrating them in societies, right? So
Hmm.
we're very backwards here. Don't shy away from these things. Don't shy away from talking to your children about how beautiful it can be to see people on the street with wheelchairs and with different abilities and people that have different limbs. And why are we scared about that? Like, I don't, and maybe it's just because my mom raised me that. My mom used to take me to retirement homes and we would volunteer with seniors who were declining. That was what we did. So maybe this is why my approach is this way, but I also saw how that impacted me. So I show my children, and my children will go up to people in wheelchairs now and like go out of their way to say hi to them because they feel like they need a friend. It makes a huge difference for our kids.
I think just it teaches empathy. I've
Yeah,
talked
it
about
does.
this multiple times on the show that my fondest memory of my grandmother through her Alzheimer's journey was we'd bring my oldest son at that point, and he would be doing puzzles with my grandma, and the
Hmm.
two of them, her cognitive decline was kind of meeting up with his cognitive incline, and they would do these puzzles together. It was hard for both of them,
Yeah.
but they would figure this thing out. And it was this journey of building this relationship between them. And he still talks about it and the impact that those small things have on him, and it's developed empathy.
Yeah. I mean, some people like this can be taboo. I'm not a person who shies away from things with my children. I brought them to the hospital at the end of my mom, not when she died, but like towards the end of her life. We made it an enjoyable thing. We did art with her towards the end of her life. We brought balloons for her. We brought cake for her, and I put it in a blender and fed it to her with a spoon. Like I've immersed my children in those experiences because I don't think that we should be shying our children away. Again, depends how some
Hmm.
children get very scared, and of course, you don't wanna expose your children if they do, but, um, I agree with you, like, it can be a very beautiful thing, but now these children are gonna grow up having empathy and also feeling that this is a normalized part of society, right? They're not scared about that, so that when I get sick, they're not gonna be like, "Oh, I'm never going." Like, it's just a part of their life. I mean, hopefully, I don't that doesn't happen, but it might.
It's possible, and
Anything's
just
possible.
unfortunately,
Yeah.
but supporting them and getting them on the right path, you never know what it could lead. Just a little step or bringing them with you to a care setting or whatever, you never know how it'll change their trajectory, their development, what they'll
Yeah.
do with their life and how they can, develop it. So I think it's a matter of building caregivers.
Yeah. Yeah.
We we can't expect it to happen tomorrow, and we can't expect the government to really make big changes that are going to change it. Instead, let's build those caregivers to be resilient and equipped and
Yeah.
empathetic. So
Yeah.
down the road, they will be there.
Yeah. We act like dementia is a contagious disease. And I think we need to stop doing that as a society.
100%. Some of the sweetest people I've met have been living with dementia. They're just truly they're living their moment, and they say sometimes what they think, and they're sweet. They just don't necessarily have the memory recognition in some folks with Alzheimer's, and just it's not a negative thing. Like you said, it's not TB or something.
No. And you can, like, I think people also just associate dementia with 95-year-olds. And I also, like, that's not,
Hmm.
people can have dementia from a traumatic brain injury. As a reaction of a traumatic brain injury, that just means that you're having a decline a neurodegenerative decline in that moment. You can have dementia from a stroke. Like, it doesn't just mean, oh, your brain is atrophying, right? Like, I think we also as a society don't understand what dementia is.
Hmm. Yeah, 100%. So, what sort of impact have you seen through your Canadian Center for Caregiving Excellence work and your co-chair work in that?
Hmm. Yeah, well, I think that the awareness as a whole from the country, at least I'm seeing, has grown substantially. We're able to speak from, like, the committee that I co-chair, we have a lived experience group who gets to talk about their diverse and unique experiences across the country, and they're able to have their voices heard too in terms of what they went through. So it's not like someone is representing them and sharing awareness. They get to say it on the ground from where they're at, which is incredible. But as I said, from the time that the CCE didn't exist to now, I have seen a profound increase in awareness as a whole in the country, to the point where someone said to me the other day, because I said what I did, and they were like, oh, yeah, of course. But if I had said that to someone a few years ago, they'd be like, you mean like a PSW? Right? Because my company's called Compassion and Caregiving. And so they would say, oh, so PSWs. And I'm like, I mean, sure, they're professional caregivers. I'm talking about caregivers. Whereas now, if I say it to people, they're like, "Oh yeah, absolutely. Oh yeah, my friend's going through that or that." So it's a very different perspective that I hear these days.
What sort of consideration is being had or conversations that maybe they can talk about regarding Indigenous caregivers? Are there
Mm.
any insights that you have, conversations you've had with CE, or maybe outside that about Indigenous caregivers and what they're experiencing or how you're supporting them, things like that?
Yeah, I mean, I definitely have had personal conversations with Indigenous caregivers. I don't want to speak on behalf of the CCCE. I think that that's their own stuff, but I definitely have had more conversations. I think the conversation that I have specifically been around the lens of, caregiving is seen very differently in different Aboriginal or Indigenous communities than they are in, I think, the white normalized Canadian communities. And so we have to be very careful about how we talk about caregiving in different groups. And that also goes with the mental health of caregiving aspect, because just because I say, hey, this is how we need to approach mental health for caregivers, I've also been told by Indigenous communities that's not how we approach mental health and that's not what we do. So we have to be very mindful that, we're not speaking for every culture and background and nationality in Canada. We are just speaking as a whole. We have to be very specific that there are individual pockets. So I can never say that I am speaking on behalf of anybody. I will also always go to my Indigenous colleagues and friends and say, hey, can you please inform me? Like, I want to learn more about where you're coming from because I don't ever want to speak on your behalf. So I also have a podcast called Caregivers Compass, and this season we are also having some members of the Indigenous caregiving community come on because I want to learn more about their lens and I want to make sure that they can speak on their behalf, because as we know, so many people are speaking on the behalf of them, and we can't do that. So we have to give them voices too. They have to sit at tables. They have to be part of strategies as well. These are marginalized communities that we need to really lift up and make sure that they're part of this entire picture and conversation, right? We can't put things on them.
Yeah, Indigenous caregiving though is complicated,
Yes, very.
especially when we talk about non-tribal health benefits and the ability that we have to access supports, but that including transportation to and from, but that doesn't necessarily reflect the lived experiences of my community. That
Yeah.
if they have to get supports, they have to leave their families. They have to, maybe the grandparents are looking after the grandkids, so they sometimes forego the appointments, the care, because they're looking after the grandkids, and they
Yep.
can't they
Yep.
can't leave, or they don't want to leave, or it's super complicated. So um, I look forward to seeing how these things can be thought out, because it's not like we've talked about things before. It's not a one solution I think it's going to solve it. I think it's a multi-pronged, complicated
Yeah.
consultation process of these things all need to work in conjunction to help drive
Yes.
solutions.
Yes, and these points are hidden. I mean, from my colleagues and friends, I do know that there are increased rates of death because of Indigenous communities being turned away at the ER or not being, not being tapped into the way that they might with other communities. And it's very, very broad, and we can't pretend that we understand, which is why I always seek collaboration because I could never speak on anyone's behalf. I don't understand other people's lived experiences if they're not my own, right? So you're right. We have to collaborate and bring all of the voices to the table. We can't speak on behalf of anybody.
One thing I think is interesting, and I'm curious your thoughts, Stephanie. Are you supporting just family caregivers, or do you also support hired caregivers
I
and
don't
giving them the
support hired
supports?
caregivers, just
Okay.
unpaid. So not
Yeah.
only family, like we've had neighbors, we've had
Mhm.
anyone who's informal and unpaid.
One thing I think is interesting is I find sometimes caregivers come with the best intentions, but they don't always understand the person at a fundamental level. Maybe, and oftentimes what I've seen is uh, culturally or
Mhm.
religious component, and they try and do what they think is best, but doesn't always work well.
Mhm.
Sometimes they do what's best, but they don't understand small, cultural nuances, body language, and it ends up turning negatively. Um, I think this is where caregiving is so complex and so unique because there's no one solution. We have to approach each person as a one of one.
Yeah, uh, exactly that. And in my hospital work, we saw a lot of refugees, a lot of
Mm,
immigrants, a lot of people who did not uphold the values of a North American medical system. And we could not make assumptions that just because we had a certain approach meant that they had a certain approach. They didn't even have the language and the insight to navigate anything. And we had to work with these people, but yet we were also enforcing what we knew because that's our medical lens, right? It's very complicated, and it was always a conversation of where do we draw the line? How do we know when we can have a say here versus when we can't? Um, so you're right. We're such a diverse country, and it, again, generationally and culturally, it's so complicated.
do you think that adds to some of the complexity to passing effective legislation?
It can, but I think the legislation that we are pretty much asking to be passed is very overarching and very basic necessity. We're not asking for like little nuanced pieces here. We're
Mhm.
asking for tax benefits. We're asking for things that financially will support all caregivers, regardless of background and culture and who you are. So, I'm gonna say no. Maybe people can use that
Yeah.
as an excuse. Uh, but I really do think that what is being asked in the strategy affects all Canadians.
Hmm. So how can you talk about Caregiver Compass and the impact it's having, how it's able to support caregivers, and what caregivers can know before they go to search it out?
Yeah, so Caregivers Compass is just it's a passion project of mine, and the purpose of the podcast initially was really to highlight the mental health aspect of caregiving, which I wasn't seeing being featured anywhere. So I go with guests very deep into, if we're having, for example, caregivers, their experiences, but also what the impact was or how they felt their mental health was impacted as a result and what they felt the impact of the healthcare system navigation was. We also bring guests on, and again, the perspective is very much about the mental health impact, guilt, shame, burnout, anxiety, depression. Like that's where we're going. And then my love and passion for advocacy is also tapped into there. So, what started out as just being this mental health thing has become a lot bigger. And we're able to spread the word about initiatives and things that are happening in our country. We also have US based guests too. So, North American wide initiatives. But we definitely have a following, and people really love to tune in to find out about the really deep parts of caregiving that aren't talked about. A lot of taboo pieces and pieces that I don't think you would think about are also present. And then I also share a lot about my story on there, and I talk a lot about my own experiences, and um which again, like, I go into very much detail about things that maybe you wouldn't hear from the emotional mental health side of things.
So since you brought up guilt, I assume that you felt some guilt at some point in your
Yeah.
journey. Can you talk about those emotions that you were feeling, the highs and the lows?
Yeah, I mean, guilt was definitely a low for me, and I felt guilt in many ways, particularly after I had my first child and I couldn't be present for my mom in the way that I had been before, or my dad, because my dad very much relied on me for a lot of things with my mom. I felt like I was being ripped into two and felt very guilty because I had to be there for my newborn, but then I also really needed or wanted to be there for my mom and my dad, and I couldn't. It was
Mm,
impossible. So I felt a lot of guilt over having to choose my daughter, honestly, because there was nobody else that could be with this little vulnerable baby. And I had to put up boundaries with my father, and as a result, my mother,
mm,
because I had to be there for her, and I felt so horrible, and over the course I have 3 now, so over the course of having children and gaining a job and building a career, I've had to say no a lot. There were times where I couldn't show up for my mom and my dad because I had to be at other places. There was a lot of guilt over COVID because my children were going to daycare and I was talking to my mother through a window. And I was working in the hospital and I didn't want to expose my mom to COVID. I was working with COVID patients. So there was a lot of guilt for me not being able to be in their house, right? And that I couldn't be upfront and forward there. And then towards the end of my mom's life, there was guilt that I couldn't be in the hospital 24/7 with her, that she had to have times where she was alone. And I held tremendous guilt over that. So to me, guilt is never really a high, but, it's also learning how to navigate that part and accepting that we can have negative feelings and they don't need to take over us, and we have to make difficult decisions, and we learn how to deal with that because it's a feeling that's gonna come up throughout our entire lives. So how we adapt to guilt is also important.
When I was referring to the highs, I was referring to maybe there was a joy moment.
Oh.
Did you guilt as being a high would be a very
Yeah, I was like,
kind of
"Oh, I
twisted
mean, that
thing.
would be cool, I
Kind
guess."
of twisted, but hey, it's different strokes for different folks, right?
Yeah.
So can you talk about if you were able to find joy somewhere in that
Ah,
caregiving experience and how
yes.
you came about that?
Yeah, me and my mom were very connected. As a little girl, I was her miracle baby, and so we were always very like, I was her pride and joy in everything. So as she went on in her dementia and as she lost a lot of functioning and ability to speak and engage, for a long time, she would react to me when she wouldn't react to other people, and that would
Mm,
make me very emotional, but also made me feel so special because there was something deep down where, regardless of what was happening in her brain, she still had this powerful connection to me, so much so that as things progressed towards the end, when she hadn't spoken in a long time and her prognosis was very poor, she told me she loved me and she kissed me, which she hadn't done in so long. And you'd think, well, that's not a high. But for me, it was because the love that we had and the depth of our relationship shine through ongoing and really challenge this notion that people with dementia are like, you give up on them, they're duds, like they're done. It's not true. And so for me, the highs were the connection for sure, and what I got to see through her even when other people gave up on her.
mm. That's beautiful and profound all in one go.
Mhm.
Stephanie, ready for a lightning round?
Yes.
All right. Coffee or tea?
Coffee.
Decaf or calf?
Caffeinated. Sorry.
One day we will have a decaf person on the show.
Oh,
One
no.
day.
I do have decaf in the afternoons. Does that count?
You didn't pick it though. Someone
No,
someone
sorry, I won't
someone
pick
said they have
it.
decaf cappuccino at bedtime. I'm like, that doesn't count
Sorry.
either.
Sorry.
One day I'll have a little bell we will ring here. One day. It's gonna be a while though, I think. Morning person or night owl?
Night owl.
One thing about caregiving you wish everyone would understand.
That caregivers are people too, and it's not just about the person they care for, but also about the people in the background.
Hmm. What is one word in caregiving you wish would disappear?
The difficult caregiver.
Mm. What is one word caregivers should be using more?
Um, I know this person best. That's a sentence, but there you go.
Hmm. What is one sign of burnout you wish people didn't ignore?
Anger.
Hmm. If you were to make a movie about your life story, who would play you?
Oh my God. Really putting me on the spot. Andrew would play me. I have no idea. I don't know how to answer this question. You can play me.
You've never thought about it?
No.
You never thought,
No?
let's cast my movie.
I have no idea.
I was asked that the other day, and someone asked me when I was filming one of these, and I was like, I don't know. I had a hard time. I was like, Matthew McConaughey. I was like, I got no. It was the
People
first name that came to mind. I was like, I don't know.
people think I could choose a person people think I look like, but now I don't even remember her name. She's in Mean Girls. I don't remember her
Oh
name.
yeah,
People
yeah.
have have thought I was her, like, on the street, which I think is I don't think I look like her, but that's fine. People really think I look like her. Don't know her name, but sure, she can play me, why not?
I don't know her name either, but I know who you're referencing.
Okay.
I know who you're referencing.
Yeah.
Couldn't tell you her name though.
No idea.
What food reminds you of your childhood?
Cake.
What kind of cake?
Cake. Birthday cake.
Oh, okay.
Yeah.
Homemade or store bought?
No, store-bought.
Okay. What is one habit that makes caregiving harder than it needs to be?
Habit, I guess it would be thinking that you have to give up all of yourself,
Hmm. What is a misconception people have about young caregivers?
that they always have, like, another parent or another older person to help them along.
Hmm. What show or movie helps you reset on a hard day?
Love is Blind. That's what I'm watching right now. It's, like, so bad, but so
How,
good.
how many seasons are there?
10, I think.
Are you so you're
10.
caught up?
I'm in the middle of 10. I was so excited when I realized that I forgot that there was a 10th season, and then when I realized it was just so exciting. It was already all there for me.
Uh, what does dignity mean to you in one word?
In one word. Mm, respect.
Hmm. What's your favorite smell from childhood?
Chanel number 5. My mother wore that one.
Hmm. What's one hobby or interest you'd love to return to?
I have done it since, so I'm thinking, like, return to. I have a Cricut machine. Do you know what a
Hmm.
Cricut
Yeah,
machine
yeah,
is?
yeah.
So I used to use it a lot. Like, I loved that thing, and now I'll use it once a year, so I think it'd be nice to use it more.
What kind of stuff you make?
I used to make all sorts of things for, like, birthday parties, and my friends would have engagement parties, and I would make them banners and T-shirts and mugs and, just all sorts of stuff. I've made my kids, their names on wood, panels for their rooms with flowers on them, and, we recently went to Disney, so I made us custom Disney shirts, but I don't use it as much as I'd like to.
That's a that's definitely a good hobby. It's
It's
convenient to
fun.
have on
It's
them.
very fun. It's in front of me. I stare at it every day.
It's tempting you every day.
So technically, I'm, like, with it all the time.
Uh, what keeps you doing the work that you do?
The outcomes and the drive that I get when people tell me how much I've changed their lives.
What's one thing you'll never stop being curious about?
Hmm. Space.
Spaces in proximity to people or spaces in
No,
outer
outer
space?
space. Outer space.
What about outer space?
I just think it's fascinating. Like, I know that there are probably so many things out there that we don't know about and vast universes. And I used to think about this all the time. Like, how far is the nearest person, not creature? Because we can't be the only ones.
It's truly a wild rabbit hole of thought exercises,
Yeah,
right?
I used to do that. I'm a very philosophical thinker. So even as a little kid, I used to sit there and think about all sorts of things. And this is one of them, space.
What's the most human thing that's happened to you lately?
Hmm. Well, one thing I can think about, it wasn't like super recent, but a few months ago, I was at a Starbucks and I was very upset about my mom passing away. And I picked up this mug that they had that they were selling, and it was so pretty. And I wanted to look at it because I'm like, wow, if I had this at home, maybe it would bring me some joy. And I picked it up and it fell and it crashed all over the floor. And so all of this meaning that I had of like wanting to uplift my day because I'm so sad about my mom just crashed on the floor. And there was so many layers to this breaking thing in front of me. And I started crying because the barista looked so angry that I had shattered this cup by accident. And I said, I'm so sorry. And she just looked so mad. And this man I've never met in my entire life came up to me and was just like, it's okay. I don't know what you're going through right now, but I just want you to know that it's okay. And I know that you don't know me, and this is probably really creepy, and I'm not going to touch you right now. And I want to give you a hug, but I'm not going to because that's not socially correct at all. But I'm here for you. And I've seen him a few times since, and I was in a much better place then. But I'll never forget that. Like, he did not have to do that for me. And it made me feel so much better. I was a bit embarrassed, but it made me feel a lot better.
I assume you saw him in the Starbucks, not like
I
randomly
saw
other
him in the
places.
Starbucks, and then the next time I saw him, he shared that he was a musical artist and shared his albums with me, and so I
Oh,
shared
cool.
his albums with my friends, and, just a really good soul, like a really good human being.
Hmm. What gives you hope right now?
Hmm. I think what gives me hope is that, again, where we were in the recent years has shifted so much in regards to caregiving. And I say caregiving because that's all that I live and breathe. And I see a lot of companies and organizations approaching us and wanting to do things with us in regards to caregiving. And that just shows that people care and know that this is a bigger issue than they once realized and that it needs to be normalized in society.
Hmm. Stephanie, I always give the guests the opportunity for the last word. What would you have to say to the audience?
Well, I want to say this was a very interesting interview, first of all. Like, good job. This is amazing. I love the structure. I know that's not what you were looking for, but I love the structure of this and I love how you piece this together. I think you're a fantastic interviewer
I
because I've
appreciate that.
done a lot of these and this felt really different and really cool. Um, the other thing I would say is just, if you're here listening to this, it means that you're doing all the right things. It means that your heart is in the right place, that you know that maybe something needs to be different, or maybe you want to change something in your caregiver life, or you're immersed in what's going on and you want to learn more. And those are the right things to do, right? All we can do is learn and grow as human beings. All I do is try to learn and grow, and we're never perfect. So if you're feeling like you just need more information and more education and more support, that's okay. You're doing the right thing.
Well, thank you, Stephanie, for joining us. I really appreciate you coming here and talking to us and taking time out of your busy schedule. So thank you so much.
And thank you. You also have a very busy schedule. Thank you so much. Thanks for doing this. Amazing opportunity for everybody.
My pleasure. And to our listeners, thank you as well for being here. If today's conversation resonated you, make sure to follow the Dementia Collective wherever you get your podcasts. Don't forget, like, share, and comment on this episode. So hopefully get in front of other people that need to see it. And if you'd like to help us grow this movement, please consider becoming a member of the Village on Patreon. Among the benefits, like the ability to ask guests questions, you'll get early access to every episode, plus the satisfaction helping powerful voices like Stephanie's reach more caregivers around the world. And finally, if you're on your own caregiving journey, remember you are not alone. We're here at BlueBell to help connect you with the supports and resources that truly fit your family's unique needs. Until next time, remember you are strong, you are not alone, and you were doing something that matters more than you know. I'll see you next time.